It's April 16th, 2020. I'm Matthew Bai. I'm an emergency room physician at Mount Sinai, Queens. Now I'm ready to go out into the ER. Don't know quite what to expect yet. I know on the overnight there was at least one cardiac arrest that came in who didn't make it. And this has been a more common thing now. I mean, the patients now, I'd mentioned before, the volume is down, but they're coming in sicker. So when they come in, they can be to the extreme where they have no pulse already, or they're coming in breathing really fast and hypoxic with a very low oxygen level, and cold and blue, some of them. This is our ER this morning. It's a big change from last week, so this is a nice little reprieve, but I'm going to guess that this is temporary. So the volume is down, but the patients coming in are still very sick. So when they do come in and they need a lot of work, it's still a lot of work and stressful on us. And it's even more stressful when the young patients come in and they don't end up making it. It takes an emotional toll on everyone. It makes us realize that everyone can be affected. And it actually kind of scares me a little bit, because if I get it, there's really no telling if I'm going to be a mild case or a serious case. The sobering thing is that these patients sometimes are the younger patients, the ones that you don't expect to come in affected this severely by COVID-19. And those cases are especially emotionally taxing because they were previously healthy and had a family, maybe even beginning a new career, and all of a sudden this happens and everything changes in a blink of an eye. And it makes the whole staff very saddened when this happens. Luckily, the hospital has provided us some emotional support that's available. There are psychiatrists that are around. Our chaplain is around that we can talk to anytime we need. And these are very helpful resources that our hospital is providing us. Very much an emotional roller coaster, and it can be very taxing throughout the shift. So at the end of my day, I always look forward to going home. And if you remember, I separated from my family, my wife and my 18-month-old toddler, about 2.5, almost 3 weeks ago, in order to keep them safe and make sure that they don't get infected with COVID-19 when I come home from my job. So I look forward every day after work to do a video call with them and put my daughter to sleep with my wife. And I really just can't wait for all this to be over so I can be reunited with them and see them in person and give them a hug.